Hi, I'm Dr. Amy Koderba. I'm the owner of Thriving Minds in Brighton, Michigan, and the co-author of Overcoming Selective Mutism, a Parent Field Guide. We are creating a series of videos this month to celebrate Selective Mutism Awareness Month in October, and my video topic today is understanding common misattributions and misunderstandings about selective mutism. And I want to tell you about two main things. The first one I want to tell you about is one of the most common misdiagnoses of selective mutism. Autism is frequently misdiagnosed in kids who have selective mutism, mainly because a lot of the symptoms and characteristics, especially in public situations, look similar in autism and selective mutism. For example, kids with autism tend to have blank facial expressions, physical freezing, poor eye contact, and a lack of speech. And so do a lot of kids with selective mutism when they're in public or school situations. Really, one of the most defining ways to tell the difference between the two is to be able to observe either in person or a video of the child when they're in the home or in a comfortable setting. For kids who have autism, their behavior remains pretty consistent in the home setting. They tend to continue to demonstrate a lot of those same symptoms, while kids with selective mutism will look much more like a neurotypical child when they're in the home setting. So they're much more talkative, they will make eye contact, they won't have that blank facial expression. In fact, a lot of them tend to be loud and boisterous and very talkative in the home setting. One of the most common misunderstandings or misconceptions about selective mutism is that it's defiance, or it's the child trying to control the situation. And I like to be very hesitant about making that assumption because I think it leads us down the road towards being frustrated or annoyed or trying to force a child to speak. We just don't have any evidence that kids are manipulatively trying to be defiant towards adults when they're not speaking. However, whenever any of us become anxious, one of our go-to strategies is to control the situation and to try to avoid whatever we're nervous about. If you can imagine anything that you might be scared of, whether it's flying or spiders or blood, probably one of the ways that you deal with that anxiety is you either try to control it, and sometimes we control things by staying away from them or by worrying about them or by setting a lot of rigid boundaries around which we're not going to become in contact with that scary activity. The other way that we deal with our anxiety is by simply avoiding it. We just completely stay away from it. We don't think about it, we don't look at it, we don't do it. And for kids with selective mutism, that control or avoidance is really related to anxiety, not to defiance, not to manipulativeness. And so I think the more compassionate and accurate way of understanding the selective mute behavior in these kids, or the unwillingness to speak or difficulty speaking, is as an anxiety disorder. And these kids don't have the coping strategies and resources to manage that overwhelming anxiety, and so instead they simply stop talking. You can find a lot more information about these in the book that I co-authored with Sherry Safer, Overcoming Selective Mutism, a Parent Field Guide. It was just released last month and we're really excited about it. Thanks so much.